Thank you very much, Carolina. So that was a fascinating session, and I just reflect on it because my background, I mainly work in geriatrics, so that the average age of my patients is in the mid-80s. And in the mid-80s, the demographics are different. I mean, we have a 75 to 25% female to male split. And when we look at the way we treat 85-year-old women, we use data from clinical trials performed on 40-year-old men because 20 years ago, women were allowed to be involved in clinical trials because of hormonal issues. So I spent the bulk of my career treating 85-year-old women with data based on 40-year-old men, and I can tell you some of the outcomes weren't quite great. So it's fantastic that we actually have those great initiatives. So first of all, welcome from down under. G'day, as I would say in Australia. Thank you very much to the ECHAlliance for inviting me along today for this fantastic global session. You do hear, Brian commented earlier that this is the global connector. Now the ECHAlliance pretty much represents every continent in the globe except for Antarctica. So I believe Brian's going to visit with some penguins soon to make sure Antarctica is joining, but it really is global. And the reality is that globally, healthcare has more in common than it has in differences. So, attending these events allows us to understand that the challenges we face in my country, Australia, and here in Spain are similar. I reflect that last year, Sydney hosted the MedInfo, the International Medical Informatics Association conference, and the opening keynote was Jordi Piera from Catalonia. So it's good to be actually here with Jordi today to discuss those issues around healthcare and aging. And today we're going to be looking at the concept of aging and how that relates. So first of all, I'd like to invite my panel to the stage. So look, a few comments around this we go forward. So today's topic is healthy aging. Now this is an interesting topic. 40 years ago when I first started at medical school, the concept of healthy aging did not exist. The reality was we related aging to disease. If you looked at any medical textbook back then and even today, if you look at the risk factors for any disease, age is predominantly one of the largest risk factors. So the older you get, statistically, the greater the incidence and prevalence of disease, and even more interestingly, and I think this was really highlighted during the COVID pandemic, the morbidity and mortality associated with disease in an aging population is significantly higher. So we never really thought about healthy aging. We always thought, as geriatricians, that we treated aging. But as the world changes, we've now shifted our focus away from thinking about treating aging as a disease, as recognizing aging as a stage of life. And how we manage that stage of life is critical, and how we help decrease the risk associated with aging going forward, and maybe even take a proactive step and change the course of life so that aging is no longer the tail end of our existence where we sit at home suffering whilst we wait for the grim reaper to come along, but rather an active process. And when we look at the concept of aging, it's a relatively new concept. So 1889 was the first introduction of pensions as a social benefit in the world. So Otto von Bismarck, in what is now Germany, I think was then still called Bavaria, introduced a pension for people over the age of 70. Now, sounds very generous, but when you consider that the average longevity for European male in the late 19th century was 46, the number of people who actually benefited from that pension was probably fairly limited. And even though 130 years later, the German economy may be struggling to meet the requirements of Otto von Bismarck's generous pension schemes, the reality is that we're only now starting to think about a population of aging. In the past, over 65s made up a very small percentage of our population. But if you look at countries like Australia, like Japan, so Australia has the second or third longest longevity in the world. Japan obviously has the highest. That population now represents 30% plus the population. And when we talk about philosophers and knowledge people in this space, The one person I like to refer to is a guy called Maurice Chevalier. Now, most of you weren't born when Maurice Chevalier was around. He was a French actor, and his famous saying is that old age isn't so bad when you consider the alternative. And think about it, the alternative to old age is actually dying. So, getting old isn't all that bad. And for those of us entering that aging phase of our life, we often hear discussions around the problems of an aging population. Well, to baby boomers who were responsible for many of the innovations that we now take for granted, we don't really like to consider ourselves a problem. We like to consider ourselves as part of the solution. Maurice Chevalier also said, a comfortable old age is the reward of a well-spent youth. So what that means is actually, when we talk about aging, it's actually a lifelong adventure. What we do in our 20s and 30s reflects on what happens to us in our 70s, and how we manage the environments around us is critical. So, in the past, like I said, geriatrics is focused on treating the aging individual. But now we need to start shifting our mindset to optimizing the experience of aging for those going forward. And we've actually seen a lot of research come out recently looking at what is aging. We always assumed aging was just wear and tear. Yeah? Our bodies were falling apart because we spend a long time on the planet Earth. But there's actually been a lot of research now looking at the physiological and pathological process of aging. And I refer you to an article in last year's Nature's Medicine, which specifically looked at the cellular functions that related to aging. And it actually is a biochemical reaction. So there's a lot more to aging than just our body parts wearing out. So today we're looking at the role of technology in enhancing aging. Yeah? And if anyone was here at MWC last year, there was a presenter, Jose Carrera from MIT, who presented on the concept of the death of death. His hypothesis was that with the modern innovation, we're extending our lifespan more than 1 year every year. So theoretically, we have the potential for an infinite lifespan. He sort of said that at the end of the day, we're probably looking in the next 50 to 100 years of average longevities of over 120 years. So how do we manage that as a society? It's going to be a very interesting challenge. A colleague of mine from Australia, David Sinclair, who's now the Professor of Genetics and the Co-Director of the Centre for Biology of Aging at Harvard University, now talks about this concept of lifespan versus health span. If you've read David's book, the reality is we've done a great job over the last 50 years increasing our lifespan, so people are now living into their 70s and 80s. But our health span hasn't increased at the same rate. So we're actually now having more years of disability, of discomfort, of inability to perform at our peak and as we go forward. So today we're going to look at how we can use technology to improve that experience. How do we enable people as they get older to actually spend a more active time in retirement? When you look at aging, it goes beyond just the medical. The medical part is interesting, but there are social issues, there are financial issues, there are cultural issues. How do we as a society take advantage of the fact that people who have been around for 70 or 80 years can share their knowledge across the sector, and how we can make sure that we provide the services they need, but also benefit from them being around going forward. So we have a really interesting panel here. We have people from around the globe who are going to tell us about how aging and technology relate in their environment. And what I'm going to do, I'm going to pass over to each of them one by one to first give us a short description of who they are, what they do, and why healthy age is important to them. So I think I'll start off with you, Adam.
Thanks, George. So I'm Adam Milward. I'm co-founder of MetadataWorks. And essentially, we create services and products around making data fair for government. So findable, accessible, interoperable, and reusable. My background, I guess, was software engineering, moved into data because the software always changes. The data doesn't. Felt like it was a really valuable resource for all of society, and led the kind of data architecture program for the 100,000 Genome Project and multiple national interoperability projects in the National Health Service in the UK. I guess I'm kind of here today because we've got a really interesting project with the National Health Service around making aging data findable and also interoperable. So we're building a national data catalog so that information about adult social care is accessible to the community. And we're also launching a new adult social care record, which is a set of data standards to make the data more interoperable so it can flow throughout the system. So yeah, I think for me it's all about data foundations. I think if we're going to improve the quality of life, if we're going to improve the way we look at society around aging, we need to get the data foundations right. We need to get the data right so that we can kind of see what's going on across the sector.
Thank you. Ulf.
Hi there, I'm Ulf Ivarsson. I've practiced for the past 3 decades as an investor, entrepreneur, and senior operative. One of my feats historically is one I'm from many industries, but one of my feats is as a co-founder of Capio, which was one of the pioneers in private healthcare provision in the Scandinavias. Moxiam, which I have the honor of being a co-founder of, is focusing on the lifestyle and well-being of our senior citizens. We'll come back to that because it's not only about the medical stuff. We need to take care of the individual, their social inclusion and so forth. And we do that through digital tools that includes mobile apps and smart ways of understanding patterns.
Thank you. Fotis.
So hello, I'm Fotis from Gnomon Informatics, based in Greece. And the company is focusing on providing digital health solutions and services. So our main product, eHealth Pass, is actually a patient-centered solution which facilitates patient-to-doctor collaboration, self-management, and looking into remote patient monitoring. And we think that we have worked a lot in a number of chronic disease use cases, which we strongly believe that a better management of chronic disease early on then prevents or rather lead to a better chances for a healthy aging. Then we are also providing a service for independent living of elderly people in Greece. This has been rolled out and used by almost 7,000 beneficiaries, people living alone in Greece. And we have received very positive feedback from those people about how much such solutions really help them and towards having a more healthy aging. And the last strand, not to forget, also Adam mentioned that, is the data. So collecting the data and now you have data coming in from various sources, like from sensors, IoT devices, from electronic health records. So being able to collect them and process them and analyze them and then produce meaningful results and insights really help towards taking the right decisions and actions. So this as a short introduction of.
And over to you, Miriam.
Thank you very much. Technology doesn't always work. So good morning, everyone. Thank you for being here. I'm Miriam Cabrita. I am a biomedical engineer by background. I did my PhD, I think now 10 years ago, on the topic of mobile technology for healthy aging in a very exciting period when all these consumer wearables were starting to appear. So this topic is very close to my heart, professionally and personally. And I worked for 10 years in academia, research and development, also in solutions for healthy aging. But now today I'm representing Shine to Europe, an SME in Portugal. It's a very social focused SME. So our aim is to promote inclusive societies. And we do this by bringing all the stakeholders at the table. If you were in the previous session, it was very mentioned that we need to bring everyone, in that case the women, and now today the elderly or the older adults, but I would go even further. So today I would also talk about a project that we are working on, Siren project with ECHAlliance. in where we have this vision that for building inclusive and also healthy aging communities, we need not only the technology, not only the citizens, but also, let's say, the construction sector. We need policymakers. We need health care. We need the companies. So you will hear me coming back to this topic a lot today.
Thank you, Miriam. Look, I should probably briefly introduce myself. So I'm George Margelis. I'm a medical doctor by training, but about 30 years ago, 10 years into my medical career, I stumbled into digital health before that word even existed. So that's when we first started putting electronic health records in place. But the one thing I did realize is that the bulk of the people that we treated in Australia in our hospitals were elderly, and we didn't know how to do it. So shifting into aged care has been a major focus. So the next question I want to ask the panel is, let's level set. What does aging look like in your country? So just to give you a bit of background in Australia, we thought we did aging really, really well. We were really proud of the fact that we had aged care providers, and there was a consensus, there was a national strategy around pension, financial support. And 5 years ago, the government instituted a Royal Commission into aged care in Australia. And the results were damning. I mean, whilst we thought we were doing a great job, when we saw what was actually happening to people who required care in Australia, it was really substandard. And as a result, there's been a huge transformation journey in Australia, including a big digital transformation around aged care. But the reality is, unless we actually engage with the aged community, we don't realise that we think we're treating them. We think we're doing the best thing for them. But the reality is, their experience of aging, as we reflected on by the healthcare system, is less than ideal. So Miriam, from your perspective, in Portugal and in other countries you've dealt with, what is the experience of aging like for people?
Yeah, it's very interesting. Thank you for the question. Also, something I didn't mention, I lived 11 years in the Netherlands and I just returned to Portugal. So I have and my research was all done in the Netherlands, to be honest. So I'm learning about Portugal now, 11 years later. The point in Portugal, I think maybe very similar to Spain, we have a very old population. A huge problem for digital health implementation is the digital literacy. It's really low. And what I would like to say is this doesn't need to be a problem. I see it as an opportunity for us working in this field we need not only to innovate in terms of the technology, but innovate in terms of the social innovation. How do we bring the technology? And maybe we need to start by teaching how to use the technology, and that's possible. We have some success cases there. And then we are just actually killing two birds because we are helping people learning about technology and using our technology that we want. So I think in Portugal, if I mention Portugal, that is for me the biggest problem. Literacy in general, because unfortunately literacy is still low, and digital literacy, it's a huge issue. In Netherlands, for example, that is not such a big problem. I mean, when I did my research, my PhD research 10 years ago, I would bring our mobile phones from the company, and people would tell me, "Oh, I have much better than that. Do I need to use that?" So it's very interesting. And if we are here and in a global and international conference, really think about the context when to whom
Fotis, what about in Greece? What is the aging experience like there?
Yeah, I think Greece also shares similar characteristics like Portugal and like the rest of the Europe. So the population is aging, and two main issues. The population is aging, and I think Greece also ranks among the top countries in Europe with most, let's say, aging population. And right now, I think the dependency ratio, so the people that are productive compared to those that are not, it's around 35%, meaning that there are 3 people, or 3.5, for every that they are not productive, for every 10 people that they are productive. And this will, the projection, so that this will be declining. So by 2070, that will be 70%. I mean, this is a huge decrease. At the point where research shows that a sustainable social care system needs a ratio of around 25%. So we can also count that the population in Greece is decreasing. So currently it's around 10.5 million, but again, projections show that it will be declining, so reaching 8.5 million by 2070. So this shows that, this will put the social care system under a great pressure, and obviously it will not be sustainable. So things need to change. And I share the same view as Miriam, so I also lived in Netherlands for a couple of years. And what I saw there compared to Greece is that people, also more elderly people, they were more active. And they were, you could see them in the streets, and they were happy, and they were active. Whereas in Greece, I think that, yes, it's not like that. So people don't really take good care of themselves. And as they are aging, then they tend to stay more at home, which further then deteriorates their physical status, increases the isolation, and all this lead to more depression rates and frailty. And obviously that, again, puts more stress into the social care system. And also if you look from an economically perspective.
Yeah. So, I mean, that's often a very common problem. Interestingly, Icaria in Greece is classified as one of the blue zones, so it actually is one of the most successful. But I was recently in Greece, and the rest of Greece doesn't necessarily reflect what happens on the island of Icaria. Oh, Scandinavia is often highlighted as the world's best example of how healthcare digitalization and the services are delivered. Can you tell us a little bit about what it's like in reality?
Wow. I don't believe we're there yet.
Look, in Australia, we look upon you as the experts.
And to be honest, the reason why Moxiam was established is that we have such a void when it comes to caring for the health, the total health of our elders. However, I must be a little bit of contrarian. I view Europe as my country, right. So let's just be frank and open. We are the victims of our own success. We are in the midst of a demographic tidal wave, and we are turning a blind eye to what really matters. What do I mean by that? Well, today we are 110 million Europeans 65 plus, going to be soon 150 million. That's not an issue because 70 is the new 50. We are much healthier today than we were decades ago. But 35 million of those 110, 35 million live alone. We have no understanding of their wants and needs because we haven't asked them. So that means we are providing health care, medical services, instead of starting where we really need the wellness of the individual. And that also means that we need to include the informal carer. How do we do that? Well, we need to start to understand. So we need to start asking. We need also get the insights from data so we can cater. And we need to supply, in my view, and that's where we have faltered so far, tools to the informal carers, but on the bequest and from no other's initiative than the senior. So therefore, we are behind. We have a lot of opportunities, but we need to get our act together now.
I think that's really important because when we talk about aging, we focus on the aging person, but not realise the ecosystem around them and the effect it has. So in Australia, we talk about that sandwich generation, the 45 to 55-year-old woman who's looking after kids and looking after parents. It's a classic scenario where they're basically getting pulled on both sides. And again, we need to look at that. So in England, in the UK, I mean, what's the experience like? And we've heard horror stories, so tell us the truth.
Not good. It's probably where we start. I mean, I'd echo a lot of the comments of the other panelists here. Probably the only thing really to mention on top of that is obviously COVID. You can't come to this area without mentioning COVID. 40% of the deaths in the first wave were care home deaths. And I think there's been huge mental health implications, activity implications following that. A lot of people aren't leaving the home now and haven't really recovered from that. So that's a huge problem. I think the over 80s with complex needs is again going to be an issue over the next couple of years. As everyone's mentioned, people are living longer. I think we can dwell on some of the negatives, and obviously the system is struggling. I think social prescribing is probably the thing that's starting to change, I think, at the moment. People are trying to look more holistically at health and wellness and trying to have more preventative interventions before people get to hospital. So probably that's the thing I'm most maybe excited about when it comes to aging, is that there are these social prescribing interventions coming in.
So I actually do have to apologise to Adam, because Australia's been poaching NHS doctors and nurses at a wild pace over the last few years. So they all come over to Australia. I think it's the fact they actually like to see the sun every now and then, so they like to come to Australia. So when we look at the roles of technology, and I'll start off with you, Adam, here, because you talked about this role, the logic of a lifelong record, including the social services. Because, I mean, 30 years ago, we computerized our general practices, and 20 years ago, we computerized our hospitals. I don't know about it, what like in other countries, but in Australia, our hospitals and our general practices still can't talk to each other because they have their own separate computerization. And now we're starting to computerize aged care, and we've, again, yet another silo of data. How does data, and what sort of technologies are you using in the UK that enable us to manage that transition? Because it's the same person from birth to death, but the various phases of their life are captured on different data systems that sit in isolation.
100%. I think it's a really important area, and obviously that's kind of my passionate area, the place I'm passionate about. I mean, at the moment, data doesn't flow across the system. We know, it's 500 million in lost bed days simply because there are a lot of people in hospital who can't get back to the care homes. In the same breath, there's so many interventions that could happen within a care home where people are having to go to primary care or having to go to emergency services, where you can have a health call or a health check that could happen within the care home. So we know there's a lot of opportunities across the piece. What we're trying to do in the UK is build essentially a standard for moving data throughout the system. So not just focused on healthcare, but also goals, wishes, preferences, activities of daily living. I think there's been a lot of work around data standardization in healthcare, but very, very little in the social care space. So I guess a plug for the NHS, we've got a new program at data.digital social care, and we're pushing forward essentially an adult social care record, which is a set of standards that will be implemented across the whole care system. So every vendor in the UK will have to show compliance with this new standard. And I think that's the foundation. If we can get data collection right, then we can start to move on to analytics, and you can bring in AI and all of these other technologies. But the first part is really, let's get the foundations, let's make sure we're collecting the right data and we're sharing it in the right way.
We will touch on AI later, because obviously it's a very hot topic, but the point you make around AI is only as good as the data we feed it, so having standards around data. So, you touched on it as well. I mean, we go beyond just the medical care, and we've seen lots of models where we can monitor people's ECGs at home, and it gives us very interesting data around their arrhythmias, but the reality is the things that relate to the person are very different to their physiological parameters. So what sort of technologies are you seeing that enable us to capture the social situation and improve it? I think that's the key to what we want to do.
I think we actually have most of the technologies we need today, and I applaud. I reached out to Adam last week after our short session, because I really like what they are doing now in MetadataWorks and the NHS. The important thing is, if we start early, we can also manage who controls the data. And I've had numerous discussions with healthcare professionals, with municipalities, with governments, and say, we cannot supply the data or share data with, the relatives or informal carers. And it struck me about 1.5 years ago, and I said, well, it's not your data, it's my mother's data. So if we start there, it becomes easier. It's not uncomplicated, but it becomes a totally different game. And that's what we are trying to do. We don't store any data at Moxiam on behalf of our own. It's only the data that is relevant for the senior. Senior can always cut the cord any day, but it is not, and it's not solitary, the source from us, but that in combination with others can help both to provide the wellness or lifestyle or social inclusion services, but also be very important when you look at diagnosis and new things happen. For instance, my dad, and that is one of the reasons why Moxiam exists, caught dementia, or 10 years, well, a little bit more than 10 years ago. He's deceased now. And you know, we didn't have anything, it was a black box. If we can turn that black box into insights, and that's a combination. It's not a nation question, it's not a thing, but it's a mindset question from all involved stakeholders.
Excellent. Fotis, in Greece, what sort of technologies are you using to support people aging in place? And again, you know, I know Greece doesn't have a very strong residential aged care facility. People stay home from a cultural perspective. How are we doing that in places like in Greece?
Yeah. Okay, so as I mentioned, one important service that is currently in place and really shows really positive, let's say, results is the smart solution assisting independent living and elderly people that live alone. And it's important that this initiative was actually promoted by health regions in Greece. And also our company is providing the service, which is actually, so there is a person that lives alone and can apply for this program. And then what it is that there are a couple of sensors at home that can detect a number of critical events, like a fall sensor, so if the person falls, or a GPS, so if it gets out of the house and then somehow they get lost. But it's not only the sensors, the technology. It's also about, we are providing the psychological support, and there is an emergency also service. So there's a hotline with experts and psychologists that can assist the persons if they feel, if they have some anxiety or depression. And also in case of an emergency, there is a panic button that immediately calls emergency services or relatives. And I say that it has positive results because by now we serve around 7,000 individuals in Greece, mainly in the central Macedonia area of Greece, but it's gradually rolling out also all around Greece, and mainly and also in islands, which are also more remotely when it comes to healthcare. And within 1 year frame, the call center received, if I remember, around 25,000 calls, and out of them, 7,000 calls were really an emergency. And then, so you can understand how many really major incidents were prevented by such service and technology. So we believe that this is something that can really help people that basically and essentially live alone at home and they don't have access to help. Also at the same time, another technology that is also, I think it's getting attention and is used is this remote patient monitoring for mainly chronic disease people. And if we manage to address and tackle the chronic disease persons, then essentially what we achieve is prevent these people from deteriorating in terms of their physical and mental health, and essentially promote a healthy aging. So we are looking into self-management of chronic disease and behavioral change. And again, when we talk about chronic disease, we can refer to people with diabetes, with hypertension, with chronic pain. And what we are looking into there using technology is, on one hand, have a closer collaboration between patients and doctors. So the patients, or the citizens rather, doesn't need to be a patient. They can be at home and they can have a set of medical IoT devices depending on the case, and then they can regularly getting measurements. And then on the other side, the care manager, it can be the doctor or a nurse, or actually a care manager can monitor the condition of the patients. So this is more going into the patients to doctor collaboration, but also equally and even more important, it's the self-management, which leads into the behavioral change. So using a set of, again, via the use of technology, you can have, you can educate people, you can make them more aware of their condition, so that they then, later on, they can better manage and then they can keep up with a good physical status.
Yeah. Look, and that concept of self-care is very important. I mean, again, my parents come from a Greek background, so on top of the Delphi Oracle in Delphi, it says, Gnosis, know thyself. So knowing your own physiology and knowing how to react to it is critical. And as we have that chronic disease challenge going forward, we just can't have enough doctors managing every diabetic on a weekly basis. So knowing that stuff is critical. Miriam, you've been doing a lot of work around that, the digital literacy and how, what are the tools? So the currently available tools, are they suitable for the people in ageing? What sort of technology do you find that people who need them in ageing have available to them? And what do they need? What are the new needs?
Yeah, thank you. As now we discussed a lot about the health technology, I dare to go a bit into the social and the connection, because what I think is amazing, and of course we talked about COVID, we cannot get away from it. How many parents, grandparents started using video calls, went to Facebook, whatever, during COVID? There was a need, and that I mean, loneliness is the epitome of this century. So that's amazing, and we are talking about quality of life. We are not how great it was, how many smiles were in the faces because they could see the grandchildren out of a sudden. And that's actually the type of technology, although I come from the health domain, that and seeing health as World Health Organization in a broad perspective, I'm very excited about. So. You see, for example, I came across recently in Portugal an app that was a bit of a social network, but people, I don't know, I don't have time to cook. I have 2 kids, I'm busy, and my neighbor, who is 80, is registered, and she can cook for me. We know one of the biggest issues with quality of life, with depression in old age, is the lack of purpose. Is that people feel I'm going day by day. I worked, especially that first period after pension. I had a purpose. I worked maybe for 40 years, or many years, and now out of a sudden, I'm waiting for the day to pass. And if these small things, and technology can help here, can help with connecting and say, I need food. Okay, why should I need to go to the restaurant if someone can cook for me? Or electricians, I don't know, and now talking from the Portuguese perspective, there is such a lack of people who are electricians, plumbers, and there is a lot of knowledge. You mentioned it in your introduction. How can we leverage on this capital, on this intellectual capital, on this human capital, wisdom? I always think that is a waste, that we are not using it. And in this, technology can also be used for it. And I think that's very important to bring to this type of sessions. That we are, of course, it's very important to talk about electronic health records. It's very important to talk about remote patient monitoring. But let's also, or not but, and let's try to go also to the social connection domain.
I think it's critical when we are here at Mobile World and opening communication channels which aren't available. And we saw during COVID, during the lockdowns, that we saw adoption of those technologies. Unfortunately, we're starting to see the fall off. And in Australia, we had a huge rise in telehealth that's now starting to fall off. But recognising that communication is still a basic human need, a basic human requirement. Now, Andy did point out earlier, this is an audience participation event. So if anyone has any questions they want to ask our panelists, look for 6'4" Andy in the back there. 6'6". He's grown in the last couple of months. To hand you a microphone and ask questions. I've got the lights in my eyes, so I may not be able to see it, but if you get Andy's attention, we'll be able to get your questions asked up here on stage as well. So, but moving along, I mean, the other challenge we face, of course, is that introducing technology into aged care is something we're passionate about. We can see the benefits. There's lots of innovation. I will touch later about how we drive that innovation. But the thing that always hits us is funding, finances. How do we pay for this? From your perspective, Miriam, what sort of models are we looking at? So if you look in Australia, for example, we have a government paid for healthcare system. it's struggling because of financial. We have a government-supported aged care system, but we had 30 years ago in Australia, they introduced what compulsory superannuation, so basically compulsory retirement planning into the system. So people like me in our 60s are now sitting on quite a significant nest egg of cash that as we go into retirement, and how we can use that cash to finance some of our things going forward. But in other countries, what's it like in Portugal and in Netherlands where you were? And I'd like to touch across that from the sector.
Yeah, I mean, ask a Portuguese to talk about money, right? It's it's the biggest challenge, and I must confess that, being honest, it's not my expertise. I've been always in the research domain, right. So I can talk about funding for research, but I can just raise another flag. Sorry, I'm just raising a lot of flags. That with all this technology, we don't want to increase the gap, the inequalities gap, and that is a problem because what I see in Portugal is very difficult to get if we talk about health related reimbursed. So the insurances is such a long process to get it in the. We have public healthcare system, contrarily to the Netherlands, and it's a bit more mixed. And that is definitely one of the challenges. And for example, what I see, I returned to Portugal and I was amazed. The public healthcare system is this amazing app. It works much better than any app I've seen for healthcare in the Netherlands. You can make appointments. It's perfect. But then you go to a healthcare center for the GP, and all the 80 plus are waiting to make an appointment there because they don't know how to use the app. So that's just the point of be careful with digital gaps.
Fotis, in your perspective, in Greece and other countries where you've worked, I mean, the financing side of it, what's the challenges there?
So obviously we don't expect to be much different than Portugal. We face even maybe more difficult times during crisis. So yes, it's difficult for people to get, healthcare services, and currently the government tries to implement the primary care so that people do have access to health services. But obviously it will take time, and currently I think it's more like private. So if you need to look for any type of health-related services, most likely if you want to, if you don't want to wait for weeks or even months, you need to go private. Nevertheless, and as I mentioned previously, this solution for independent living, it's important again to mention that it is funded by the health regions and the municipalities in Greece. And it started again from Central Macedonia in Greece, and now it's rolling out in different regions. So that's a very interesting and positive step.
And it's like health economics analysis have been done on that? 'Cause, the money you save by not having people jumping in and out of hospital covers the cost of the technology?
Exactly. Yeah.
Excellent.
Yeah. And also another important aspect, it's not in Greece, but what, if you look in Europe, what happens already in a couple of countries like Germany, France, is that the individuals may get reimbursed for using some sort of solutions, technological solutions that can help them with their condition, and this can be prescribed by doctors.
Right.
So, similar like medications, the doctor can prescribe.
Integrating it into the healthcare service. Excellent.
Yeah, and this can be reimbursed. So that I think that will help also the adoption of such solutions if it also expands in other countries.
And
I don't know in Australia if it's...
we discussed this earlier about in Europe in general. How much of it is private pay, how much is this public pay, and are people prepared for the costs of aging? Because we, in the past we didn't have to worry about the cost of aging. We died young, but hey, now we have to worry about those savings lasting us through the 80s and 90s and potentially 120.
And this is perhaps one of the most, let's say, toughest question to handle. Technology-wise, we can have people live a long time, but can society provide for all services for free?
That is a question. What is the level? What is the basic foundation? Europe in general has a welfare provisioning. In Scandinavia, if you excuse me for saying it, we are, social welfare junkies. We think that society should provide for all things. But who's society, guys? It's us. We need to start to take the initiatives ourselves as well. And we need to provide the capacity for innovation. That doesn't come from institutions, being private or public. We need to find the solution and also serve and having purpose. I really like that, Miriam, because that's what Moxiam is all about. It's about purpose. Let's make it simple. We sometimes also try to have having a service being as complicated or as fulfilling as possible. Let's start with the low-hanging fruits, with the easy ones that everybody can embrace. This is the initiative, one of those we are trying to do. In March, we're going to actually release or launch a free service for elderly people where you can download the app and get 3-4 basic service that is now, we've asked the seniors, right, not anybody else. So all the development is done from focus groups with seniors in Sweden and Holland. And I'm really proud of the guys. I'm going to see if we get any users, but it's going to be free download to use initially, just because we need to get the engagement from everybody.
So people should look up Moxiam on their app store in the near future for looking for that app? So yeah, we heard it here first. And one of the things that we'll be discussing later in this session, and it's unfortunate we don't have our colleagues here from Africa with us today, but last year Amitaka, who was from the African Digital Health Unit, talked about frugal innovation. So they're developing solutions that don't cost, I mean, because yes, ideally we'd all love an Apple Watch and an iPhone, but that's 2,500, 3,000 euros down the track. And in Africa, they're doing something similar, but measured in single-digit euros. So those are interesting. Now, England, I mean, I understand the health minister and the secretary of the treasury won't talk to each other anymore because of the health challenges. Is that what's the financial situation as far as ageing there?
Well, I think it keeps changing, as you alluded to it. There was this policy for a care cap and a funding cap, and that seems to have gone out the window. But I guess watch this space. I guess the big thing that I think Ulf mentioned as well is unpaid carers. So we've got over 5 million unpaid carers that we're not really quantifying. That we are funding social care, but we're kind of doing it through that medium. I think the figures are about, in terms of long-term adult social care for over 65s, I think it's about 8 billion at the moment. It's coming from public funds, about 8 billion from private funds. So I think there's a lot of money going to the system, but there's a huge funding gap. Every time, every publication that comes out says there is this huge funding gap. It's growing. And there needs to be a holistic model to look at it. I think, we've alluded in some of the other parts of the panelists' responses, but it's housing, it's planning for housing, it's planning for services, it's your local authority. It's not just health and residential and social care. There are all these other aspects, and if you underfund those parts of the system, then it ends up kind of hitting eventually the healthcare system anyway. So I think, ultimately in the UK it's a huge problem, and we're struggling like everyone to deal with it. And unfortunately we keep changing our minds. That doesn't really help.
It's interesting, my children call me a boomer and tell me that I'm really the reason they have to pay so much tax and why their life is so expensive. So they blame me for it, but they still keep on living at home and sponging off me, so that works fine. We do have a question from the audience, Andy?
We do. Better a boomer than a boomerang, George, but hopefully you'll forgive the Australian. So we have questions time from the audience. Introduce who you are, where you work, and your question. Remember what I said at the beginning? Questions are short, they're not boring and long-winded, and they're not a statement, so they end with a question mark.
Thank you so much. My name is Vania de la Fuente Núñez, and I'm Healthy Aging Senior Advisor at the Fred Hollis Foundation. You've mentioned quite a few apps that you're using to address the needs of older populations, be it healthcare needs, be it connection needs, other types of needs. But we also know that there's a huge digital divide in the older population, in the current older population. We may not have the same digital divide in older populations to come. But my question to you is, what is the uptake of those apps that you have, and how are you addressing inequities in actually accessing those apps? So we know that, for example, the older you are, the less likely you are potentially to use these apps. the less likely you may be to have digital literacy. We're talking about this. So who is it that you're actually reaching within the older population? Is it the highly educated, those who have higher economic means? And who are you leaving out, and how are you addressing those inequities? Thanks.
Who'd like to take that first?
Yeah,
Fotis?
That's very interesting question, and it's a challenge always when we talk about digital apps and technology to be used by more elderly people. First, to say that elderly people or people that are aging are not as incompetent as we think they are, technologically wise. So, for example, also my father is close to 80 now, and he's able to use his mobile phone. He can browse and he can do various stuff. But you are right that this is always the challenge that we face also when we go to the end users, which are primarily people that may not be so competent. And then this obviously affects the uptake. So you don't have the uptake that you wish to have or you think you can have. So we are also being part of consortium of European projects, research projects that they are looking into this challenge. So create solutions and digital apps that are user friendly, so that you can face this challenge. And there, what you can do is, for example, you have a lot of co-creation sessions. So you don't get to design and build this idea in your office, in your company, isolated. No, you get to the end users, you talk a lot with them, you get the feedback, and then this is the co-creation part. And it can be the end users, it can be the healthcare professionals, so all the stakeholders that are involved and essentially will use the solution.
Alf, you had to come comments on that, Alf?
When we started 5-6 years ago, we had that question with us continuously. I've stopped with that because COVID showed us if necessity is, we can do it. The important thing is making the availability, the ease of use, and the affordability, because digital literacy has to solve itself, because if we don't approach that level, we will not be able to serve.
Excellent. Miriam, you're going to that?
Can I just say something about it? I don't have numbers for you about uptake because I work, again, mostly in research. But what I see, and as much as we have the effort of co-creation, and we do it in all projects, still, people who appear in these sessions are mostly highly educated. I can give you an example that worked, I don't know, 10, 12 years ago. In Italy, we had an European project where, again, we were developing technology for prevention frailty in Netherlands. Everything fine. We went to Italy. Of course, people were not interested. So if I can give one tip is go to the place where people are. And in Italy, guess what? Is the church. So we went to the churches, or our colleagues from Italy, from the project, went to the churches and approached people at the end of the church mass, I think is the word, sorry, in English. And from there started creating this awareness first, because you have to make people aware that there is a need and there is a possibility. That's not that difficult, going through the ease of use. But that is the tip I want to do. And this is not easy. We try in all projects. We try to work with the communities. We try to go to the daycare centers, depends on the organization of the country. But for example, in Italy, church was a very good place.
Yeah. So obviously engagement with individuals is key. And I think to your point also, the other challenge is fragmentation. The fact that you may have 15 different apps you need to manage and how you do that. So rather than signifying that. Andy, we've got another question over there?
Time for one more question, I think. Introduce yourself and then...
Hello, I'm Kylie Shea. I'm the team lead for access to assistive technology with the World Health Organization. And obviously my question is about assistive technology. And so really interesting work, and I'm wondering across the breadth of the different services and the work that you're doing, if you've thought about or have examples of using digital technology in order to improve access to assistive technology amongst older populations, whether that's about increasing awareness of what's available for them, or perhaps supporting the workforce, or supporting the actual means of access. Thank you.
Who'd like to take that one? Adam?
I guess there's a few programs going on in the UK around kind of services that provide accessible technologies, and I think there's a project called Open Referral that's trying to standardize the way that those technologies are described and those services are described. So I think that's also a key point, if you can standardize that, because there will be a lot of assistive technology, a lot of technologies in general that are coming online now, and you want to be able to categorize them and find out what they're doing and obviously how they can help people. I guess the other side from I'm going back to the data foundations, that's my piece, but I think they have to be interoperable, so I think it's all very well having these technologies come online, but if you're only focused on that one piece of technology and you're not taking that back and sharing it with your carers, with your care workers, with your GPs, then it limits the benefits of some of those devices and monitoring devices and all sorts of other pieces. So I think those are the two areas.
The question of assistive technology is quite interesting. There's a guy in the UK, Kevin Doughty, who's been doing quite a bit of publication lately, looking around the roles. But we talk about clinicians prescribing assistive technology, but the reality is most clinicians don't know what's out there. So it's really important from a technology sector to let the world know what assistive technology is out there. We've got 1 minute and 56 to go, so I'm going to be wrapping up. As you see, healthy aging is critical for us going forward. It's an economic priority, it's a social priority, it's a cultural priority. It's really important to me because I'm one of those people who are entering that age space. But the reality is, it's a global issue. I was in Dubai recently, and their average age is 37, so they thought aging wasn't a problem. But I said, hey, 40 years ago in Australia, our average age was 37 too. We didn't think it was a problem, and now we're really struggling. So how we respond to the healthy aging crisis is critical. Technology plays a significant role. Literacy, education, policy support, all those things are critical, but we really need to do it together. Now, on that note, I do invite anyone who wants to visit Australia next month, March 25, 26, 27. We do have an Innovation and Technology Across Care conference on the Gold Coast. Beautiful place to be this time of year. John Warner, who's the other ECH ambassador who's currently in Los Angeles promoting the healthy aging concept over at Vive, will be there. But this is something which requires a global solution, and the ECHAlliance is perfectly aligned to ensure that global solution benefits us all. So join the ECHAlliance, stay across what's happening, join the new thematic ecosystem, and Andy will be promoting that very actively. Please join us. We will be having a number of online forums going forward. Please join me in thanking these amazing panelists who managed to squeeze 5 hours of content into 1 hour. And I will hand back to Andy to hand over to the next session.
Thank you very much.